Good afternoon, and thank you for joining us. We're holding today's briefing at the State Emergency Operations Center here in Springfield. Standing with me today are Sangamon County Board Chair Andy Van Meter, Sangamon County Public Health Director Gail O'Neill, and Department Chair Dr. Brian Miller, Illinois Municipal League Director Brad Cole, as well as the state agency directors that are leading our COVID-19 response, Dr. Ngozi Ezike, the director of our Illinois Department of Public Health, and Illinois Emergency Management Agency Director, Brigadier General Alicia Tate-Nadeau. I want to start with a reminder that we have our COVID-19 state hotline number that people should know about now, available in English and Spanish, and Polish and Mandarin will be up by the end of the week. To help answer any questions that people may have, I want to remind you of what that number is, and I would ask you to publicize that if you would. The number is 800-889-3931. My administration created this hotline for the same reason that we launched these daily public updates. It's our priority to communicate with you regularly, responsibly, and honestly. These sacrifices are difficult for all of us, and to get through it, our residents deserve to be equipped with the most clear and reliable information that they can get. I know there are rumors flying around on federal and state action, and I encourage the press and the public to function with a heightened commitment to truth and verification in this unprecedented situation. Here in Illinois, you will be able to get all the facts directly from me and my administration at this daily press conference. Last night, the CDC announced its strictest national recommendations to date, advising against gatherings of 50 people or more for the next 8 weeks. There is new guidance out just moments ago from the President of the United States, and we can talk more about that in the questions and answers. But as a result of the guidance that's been given, I am mandating that any gatherings of the 50 people or more guidance by the CDC will be canceled. Illinoisans who can stay home should continue to do so. It is imperative that our residents take responsibility for themselves, their families, and their communities at this moment. As you know, at 9 p.m. tonight, all bars and restaurants across the state of Illinois will close their dining rooms to the public through the end of this month. This was a difficult decision, but it's what the medical experts and the scientists tell us that we must do to safeguard the health of the people of Illinois. My administration is working with restaurant associations and owners and food delivery services to find options to safely keep kitchens open for drive-through, for curbside pickup and delivery during this period. I know that there are Illinoisans all across the state who get their paychecks from bars and restaurants. My administration has expanded unemployment insurance to cover individuals without access to paid sick leave or who are unable to work due to COVID-19. I have also directed my administration to do everything in our power to provide assistance to every resident who needs it, including seeking a moratorium on utility shutoffs for residents who can't pay their bills during this period, and filing a federal waiver to expand Medicaid. Today also marks another hiatus that's an important part of our effort to curb the rates of COVID-19 spread. This is the last day of school for our K-12 schools across the state until March 31st. We must protect our children and their parents, as well as the educators, administrators, and staff people who work at our schools. And since each of them can also be a carrier of COVID-19 back home if they become infected in school, we needed to stop people from bringing the virus home with them. Yesterday, members of my staff and the Illinois State Board of Education held 6 hours of tele-town halls with our 852 superintendents from across the state to answer questions and work through any remaining challenges. I want to thank our superintendents who have worked very closely with us in designing the best approach in their communities, many of them working around the clock with our team at ISB to meet the needs of the children, parents, teachers, and administrators throughout our state. We'll continue to distribute meals to all children who qualify for free and reduced lunch through a combination of delivery and parent pickup meal options, depending on the district. We're also encouraging schools to expand their meal distribution program to all children under 18 years old or to any student enrolled in an Illinois school regardless of their age. Here in Springfield, District 186 is offering bagged breakfast and lunch for pickup from 8:30 a.m. to 10 a.m. at 4 locations across the district: Lanphier High School, Southeast High School, Springfield High School, and Franklin Middle School, with more sites and delivery methods to come. A week ago today, I formally declared a state emergency, activating the State Emergency Operations Center, which is where we are today. The SEOC includes decision makers from every state agency and acts as the coordination center for crisis management response and operations to notify, activate, deploy, and employ state resources in response to any threat. I want to express my sincerest gratitude to the many unsung heroes who keep this operation moving 24/7, the vast majority of whom the public will never know. Springfield is also home to one of our 3 state-run COVID-19 testing labs, which are also located in Chicago and Carbondale. These facilities and their personnel deliver us some of the fastest results of any state when it comes to COVID-19 testing and support our Sentinel surveillance operation to monitor for the virus all across Illinois. 15 hospitals statewide are running the program, with more to come. 3 hospitals here in central Illinois, 7 hospitals in Cook County, 3 hospitals in other areas of northern Illinois, and 2 hospitals in southern Illinois, all performing this Sentinel surveillance. Together, our state lab and hospital partners are ramping up testing to the levels necessary for us to better understand the presence and patterns of the spread of the virus in Illinois. But to get a full picture of that, we need the federal government to lead, follow, or get out of the way. From the beginning, I've been pressing the White House for a rapid increase in test deployment nationwide. There are COVID-19 tests available right now that have been approved for use in Europe and use in Asia that are not available in the United States. So I'm calling on the FDA to review and approve these tests as soon as possible. Precious time has been lost because the White House made some bad decisions early on, which led to the current low levels of testing across the United States. But at the state level, we've had to scramble to create more testing capability on our own. Our hospitals and our research centers in Illinois, which are some of the finest in the world, were finally given permission by the federal government to develop our own tests, which has expanded testing availability, but still more must be done by the federal government. To the people of Illinois, and to all the people across central Illinois and Springfield, I know it's easy to be overwhelmed by all the news that's coming at you right now. But I also know that Illinoisans have the courage and the generosity and the empathy to find our way through. We've seen our people's caring and generosity of spirit on social media, in neighborhood groups, in local businesses, from the team at Capital City Property Management delivering bagged lunches to Illinoisans in need, to McAllister's Deli in Springfield offering free weekday meals to kids, to the community micro pantries that have been popping up all across this city. The people of this state know what it means to be there for one another. It's one small step at a time, and we will get through all of this together. I want to thank all of you for being here, for helping us get our message out to the people of our state. And I'd like to turn it over now to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you, Governor Pritzker. Again, my name is Ngozi Ezike, and I'm proud to serve as the Director of the Illinois Department of Public Health. As the Governor mentioned, we have a serious situation here in Illinois. We now have 105 confirmed cases of COVID-19 in 15 different counties across Illinois. We have 2 new counties that have developed cases, Peoria and Will counties. So the numbers of cases are increasing each day, as is the number of locations. People should assume that this novel coronavirus is in their community and take steps to protect themselves and reduce the spread. There is evidence that the transmission of the virus often occurs when symptoms first develop, so it's important to limit close contact with people as much as possible, even if you don't feel that sick. Along those lines, if you do have mild illness, we ask you to stay home and rest until you're well. If your symptoms progress, call a healthcare provider, and they can determine if you need medical treatment and implement steps to reduce the risk of exposure to those in the waiting rooms and to the healthcare workers that are in the medical establishments. If you do seek medical care, and we ask that you do so responsibly, know that not everyone needs to be tested for COVID-19. Based on the CDC guidance, your healthcare provider will evaluate your symptoms, ask about contact to a known case or any recent travel to an affected geographic area, and evaluate if you are at higher risk for serious illness. Based on these factors, the healthcare professional will determine if testing is needed. We want to remind people that we are prioritizing testing for those who are at the highest risk of illness, and ask those who have mild symptoms and do not meet those criteria to not demand to be tested. We need to reserve our testing supplies for those who need them most. Again, those who need them most would be those of advanced age, those residing in long-term care facilities, those with pre-existing medical conditions like heart disease, lung disease, who are on hemodialysis, who have liver disease, or who are otherwise immunocompromised. We also need to make sure that the worried well, or those with mild symptoms, are not overwhelming our healthcare system. We want to make sure that we have available beds for the sickest patients in our communities. It is important that we reduce the amount of virus circulating in the community. This happens by reducing the number of people who come in contact with the virus. Bottom line is, stay home as much as possible. If you don't have to go out, please practice good health actions. Try to keep 6 feet between the person you are talking with. Make sure you wash your hands properly. That involves washing for at least 20 seconds with soap. Clean frequently the surfaces that are touched most often. And sneeze or cough into a tissue. And then remember to wash your hands or use sanitizer that has at least 60% alcohol. These are all things that we must do. It is these steps, however mundane, that will make the biggest difference. We know that there's a lot of disruption that will be caused to many people, all of us in our communities. But the hope is that when we look back, our actions that seemed like drastic steps, we hope that it would be an overreaction. What we don't want to be is in a position where people will be looking to their leaders and asking or wishing that we had done more. We want to be successful in preventing as much illness as possible. We want to limit the casualties that we have seen around the world. And with that, I will summarize these comments for our Spanish-speaking population. Como dijo el gobernador, ahora tenemos 105 casos confirmados de COVID-19 en 15 condados de Illinois. Hoy tenemos 2 nuevos condados en Illinois, Peoria y Will. Como ustedes pueden ver, el número de casos sube cada día, también el número de lugares. Las personas deben asumir que COVID-19 se encuentra en sus comunidades y deben tomar medidas para protegerse y reducir la transmisión. Existe evidencia que la transmisión del virus empieza cuando los síntomas comienzan por primera vez. Es importante limitar el contacto con las personas cuando sea posible, incluso si no se sienta tan enfermo. Le pedimos que se quede en casa y descansa hasta que se siente bien. Si te sientes más enfermo, llame a su doctor y ellos pueden avisar si necesita tratamiento médico. Si busca atención médica, le pedimos que lo haga en una manera responsable. Sepa que no todos deben hacerse la prueba de COVID-19. De acuerdo con el CDC, vamos a evaluar sus síntomas, preguntar sobre cualquier reciente viaje y decidir si tiene riesgo de enfermedad grave. Con estos factores, el doctor decidirá si se necesita la prueba de COVID-19. Necesitamos reservar nuestras pruebas para los que más lo necesitan. También debemos asegurarnos que personas con síntomas bajas no llenen nuestras facilidades médicas. Pedimos a las personas que no tienen síntomas altos que se queden en casa. Es importante que reduzcamos la cantidad de virus que circula en la comunidad. En pocas palabras, quédese en casa cuando sea posible. Si tiene que salir, practique acciones de buena salud. Trata de mantener 6 pies entre la persona con quien está hablando. Asegúrese de lavarse las manos correctamente y con frecuencia. Limpie los lugares frecuentemente tocados y estornude o tosa en un pañuelo y luego lávese las manos y usa desinfectante para manos con al menos 60%. Estas son cosas que todos debemos hacer. Estos pasos harán una diferencia. Yo sé nuestras acciones parezcan pasos drásticos y tal vez un exceso, pero eso significa que la salud pública, con la ayuda de las comunidades, nosotros paramos la enfermedad y las muertes. Gracias. Y with that, I will turn it over to Chairman Van Meter.
Hello, I'm Andy Van Meter, the chairman of the Sangamon County Board. I want to thank the governor, the Illinois Department of Public Health, and the Illinois Emergency Management Services for their leadership and excellent communication throughout this challenge. The coordination and support has been outstanding. The governor's decisive leadership, I am sure, has saved lives. Next, I want to make clear to our community that we have the most incredible local team of first responders and medical professionals working together like a world championship team to protect this community. I have no words to convey the professionalism and dedication I have witnessed. I want to also thank Mayor Langfelder, who has led the way in emphasizing cooperation and coordination. Lastly, I want to make clear that this virus is deadly serious to our most vulnerable population, but we will get through this. We will get through this if we all follow the guidelines laid out by our medical professionals. It's my pleasure to introduce Director Tate Nadawa, EMS.
Thank you, sir, and good afternoon. As the situation evolves, we are keenly aware of the needs of our residents and our first responders. As I stated yesterday, the state of Illinois will not put our residents or our first responders in jeopardy. From the state all the way to the local level, we continue to work with and train with the professionals through an interagency approach during these trying circumstances. However, the public plays an important role in keeping our first responders safe and our communities. Please remember that 911 is for emergencies. If it is not recommended that you call 911, if you are experiencing flu-like symptoms, our first responders are outfitted with PPE, with personal protective clothing. There is no need to purchase dozens of packages of toilet paper at any one time. Let me be clear, hoarding is irresponsible. Please be considerate with others. Our retailers continue to stress that we cannot have an issue with food or with food supplies. But when people go out and buy more than they can really need, they are hurting our most vulnerable neighbors. Please stop buying more than you need. Our Illinois retailers and private sector partners are engaged in this matter and are working collaboratively to address the needs of our communities. Also, I want to keep in mind that the statistics show that 46% of individuals expect to rely on their neighbors during an emergency. Neighbors helping neighbors, a way to ensure that we build community resiliency. Send your neighbor a text or give them a call and check on them. It only takes a minute and it can make a difference. Sir, at this time, I'd like to ask you back to the podium.
Thank you. I just want to take a moment to thank many of the businesses here in Springfield, across central Illinois, and really all across the state who have been so cooperative in making sure that our supply chain is moving, that we're able to restock our shelves, that we're able to serve people with the needs that they may have. And in many cases, they're making sacrifices, not just those people, not just the grocers and others. I'm talking about businesses that have shut down or making sacrifices for their employees to make sure that everybody is sharing a little bit in the burden here and also helping each other. The general said neighbor to neighbor. That is what's happening across the state, and I'm really proud of that fact. So with that being said, happy to take a question. Dave.
Thanks. Governor, how was that conference call with the president today?
Well, it was interesting. There were a lot of governors on the call, the vice president and the president and a few other officials, including officials from the HHS and CMS, all of which have something to do to step up that the states need. I would say that we learned a little bit on the call about what the federal government intends to help out with that they hadn't mentioned before. But mostly, I think we were all interested to share the ideas that came from the questions that the governors were asking of the president.
Yeah, did he really say get your own stuff, just try it yourself?
What he said was, and it was clarified later in the conversation, somebody asked a question about it. I'll just put all that together. I think what was meant to be said was that the federal government is attempting to obtain more respirators and ventilators, so the masks and the ventilators, and they're working on that. They're also encouraging the states to go ahead and use whatever supply chain they may have access to try and obtain our own as well. So I think it was the encouragement. I think the words didn't quite come out right from the president, but I think that was the gist of what he was trying to say.
Governor, last week the declaration you made activated the National Guard. What is their role in this, and when will they step up and have a more larger presence?
Well, it gives us the ability to have the National Guard help us. There are a lot of functions that the National Guard is so capable of, including, for example, some medical functions. As you know, our great concern here, in addition to all of the other challenges, the biggest concern really is that our hospitals and our health centers will be overrun with cases and that we'll run out of space, essentially. And we won't be able to bend the curve enough. So what we're doing to work on that in part includes helping hospitals expand their triage before people go into an emergency room. Just one example, you've seen it in a few other places in the nation, is to set up a tent or an outbuilding near the emergency room, but outside of it, so that people who might have COVID-19 aren't traipsing into the emergency room and possibly giving it to somebody else. So, kind of a respiratory tent almost, so that people can be screened there before we decide, or they decide at the hospital, what to do with that patient. So the National Guard can help with some of that, either putting up tents or being part of the provision of equipment. And I have to say that our Adjutant General, General Neely, has done a terrific job of working with our Emergency Management Agency, our Department of Public Health, to try and coordinate the needs, and that's just one example of the way he's done that.
How are they helping with law enforcement that may deal with people who are not complying with orders to isolate?
Well, we obviously, you can't police everything all the time, and so we obviously want communities to understand what the limitations are, understand what the orders are that have been given, and to follow them. And so we're gonna do our best to have the communities managing themselves. And I think you've seen on social media and elsewhere, the vast majority of the public understands what needs to be done here. There are a few people who want to resist and want to talk about resistance against it, but I think at this point, the public is kind of reining in those outliers.
But Governor, there's also restaurant bar owners that say that they're going to defy this order that you had. Some are even holding huge, extravagant parties today because they know that some people may not be coming to their establishments. They want to celebrate St. Patty's Day. What do you say to them?
Well, I would say to them that weeks from now, months from now, when one of those partygoers, one of those people that they defied the order to have into their establishment becomes sick, perhaps dire, somebody perhaps that might die, that they should know that they are responsible for that, and they should not hold these parties. We not only heard, the CDC yesterday issuing guidance to limit gatherings to 50 people, but now today we've heard that there's guidance to limit gatherings to 10 people. And we're adjusting in Illinois our guidance to 50 people, but I should say that's the order is now at 50 people, and we would encourage people to follow the CDC guidance. So back to the restaurant owners and bar owners who are defying the order, and they are the outliers. I mean, let me be clear. I have talked to many, many restaurant owners now and reached out and talked to the associations and lots of people on calls with me. And they understand we are in a very serious moment in the history of our state and our nation, and that people need to make sacrifices, and they understand that this is part of what their duty is.
Governor, how many people from Illinois are in quarantine in Georgia after getting off of cruise ships? And it sounds like Wisconsin has been able to bring people home, so why can't Illinois?
So there were 51 passengers that are from the state of Illinois, and they are in quarantine at Dobbins Air Force Base. We've been advised, and the best medical advice is that they should stay in place for 14 days, and that after the end of 14 days, they would be free to come home after that quarantine. We've reached out to all of those passengers individually. Some have chosen not to give out their names and phone numbers and didn't want to be contacted, but the vast majority of them did, and we spoke with them, and those who had challenges that they needed overcome, my staff worked on each one of those things. I made calls myself on behalf of several of those passengers, one who needed to make sure that their medication was delivered to them. We got those things done. And the first passengers that will come out of quarantine will be in about a week, and so they'll be coming home, and we're going to welcome them home.
Governor, we have some questions coming in from journalists that are working from home, if you please.
Yes.
There are maybe 2 or 3 here. The first one is about the election tomorrow. You and your department have decided to go ahead with that.
Yes.
With 50 or more folks, the CDC saying that's it. Have you had any second thoughts about this, and are we still okay?
Look, we have to have our elections continue, in my opinion. This is the right thing to do. Our democracy needs to go on. We need to elect leaders. If we canceled these elections, when would you have an election? Would be a question I might ask. But the most important thing is that we're taking every precaution. Every time somebody goes and votes on a voting machine that people are touching, it's being wiped down. We have guidance to all the election judges to make sure to maintain social separation distance. We're making sure that we have sanitizer at locations that people are voting at. And then just remember, we have a terrific early voting mechanism across the state. Not only could people go in over the last 44 days and today to early vote, but also we have vote by mail. And we've had record vote by mail in many areas of the state. So I feel good about the decision to have the election go on tomorrow.
Please, another question from a journalist that can't be here. Becoming an election judge normally requires watching a few hours of a training video.
Yeah.
Tomorrow, Chicago officials are so in need of judges, it is now said if anyone shows up, can be sworn in on the spot. Is there going to be problems with that?
Look, remember, there are a number of election judges at any given polling place. So, and we're in an unusual circumstance. I mean, look, there's no question about it. We're challenged in so many ways across the state. This, I think, was a reasonable accommodation to make. Many people actually have taken that training over the last few days in order to act as substitutes for people who decided not to be an election judge on Election Day. So we've had replacements who've been trained. And because there's a need for a few more, they wanted to make sure that there's an opportunity for, if volunteers want to show up and be helpful, they'll be part of that cadre of election judges and follow the directions of those other election judges.
One more question, please, Governor. You had mentioned there are 15 hospitals statewide doing testing.
Yes.
But apparently there's no list of these hospitals.
Correct.
Could someone please, maybe either yourself or someone, address that?
Well, we're actually choosing not to talk about the individual hospitals, and the reason is this is what's called sentinel surveillance, and so the idea is that we want to get a sense for what's going on in the communities. We don't want people to show up at those hospitals presenting symptoms. We want it to happen naturally, right? Otherwise, if you announce the hospitals and they think that, oh, well, that's where testing is going on, then you might end up with a line of people going there and not to some other healthcare institution. So we want it to happen naturally so that we can get a sense for how many people in a given community are contracting the virus.
How can you be confident that?
I just want to grab this question. I'll go to you, Jerry, I promise.
Does it make sense to hold the primary election tomorrow? We've closed schools, we've told people to stay home. We're telling people to stay home, yet we're encouraging them to come out to vote tomorrow.
Yeah. Again, I want to remind you, many people have voted early already, still have an opportunity today. The polls are still open today for people to go in and early vote. At any given moment, there really have not been large crowds at many places at any given moment. And tomorrow, as you know, the process of voting is a very relatively short process, right? To go in you're with a machine really, you're facing people to check in. And they're going to give social distance to people, but the total time in a location and engaging with a group of people isn't very much and doesn't really happen. So we do believe it's safe. We've certainly consulted experts, and we think that the election will go on just fine.
Do you concern people aren't going to come out to vote because they're afraid?
We can't control that. But I will say that we've created every precaution. Again, there's sanitizing going on everywhere. In most school districts, because school is not being held on Tuesday, those school districts have actually done a deep cleaning. Many schools have done a deep cleaning so that there won't be interaction with students at that school. There will be, some personnel. There'll be election personnel at those schools, and the schools themselves will have been cleaned.
How can you be confident things can reopen on March 31st? And do you foresee bars and restaurants having reopening parties where this is reintroduced to the public? Do you think you should have set indefinitely for those days?
As you've seen, this challenge that we're all facing is evolving day by day. We're trying to make good decisions as we go. We're trying to stay ahead of this. I think I will say that I believe that the state of Illinois has been a leader, that we've been ahead of where our peer states have been in terms of reacting here. We're trying to do that as we go. But look, things evolve. We'll know more over the next couple of weeks, whether we're making a difference, whether the numbers are continuing to increase at an exponential rate. But I would say to people that they too should be watching the news, should be tracking the numbers to get a sense for what direction things are going.
Some restrictions should we expect?
Sorry, Doug, I hadn't taken a question. Sorry.
Thanks very much.
Take one from
Airport and mass transit, what restrictions could we expect?
Let me get Doug first, and then I'll come to you, Dave, I promise, yeah.
We've heard from some bar and restaurant owners that they've got a state tax payment that's due in a matter of days. Are they going to be given any relief from that?
We're working on that. My team is working with the Department of Revenue. I don't have any announcements to make yet. I mean, I would say to you that, there's a balancing act here. We want to be good to our small business people. There's no doubt about it. And I care deeply about making sure that entrepreneurs are successful, and we live in a moment that is going to be challenging for everybody. And the balance that we're trying to make is that, there's delays, for example, could be an enormous hit to the state of Illinois. And so we're trying to work with the federal government to get a little bit of help in providing that relief. So that's the discussion that's going on right now. But we are focused on it. You should let small business people know that we are focused on exactly that.
Governor, some mayors have talked about banning liquor sales or even banning weapons sales or ammunition sales or anything along those lines. Retailers are saying that they understand the closure of the dine-in restaurants. They're also saying don't close pharmacies, don't close gas stations or anything along those lines. Can you kind of address those things? And are we facing like a total shutdown in the state?
Well, again, you're asking questions that I can't fully answer today because the scientists and the medical doctors don't have answers to those things either. Obviously, the fundamental functions that people need, right? Being able to put gas in your car and all that. I do not anticipate that we'll be doing anything that will prevent people from getting in their own car if they absolutely need to. I would suggest to people they should stay home, but they may need to go to the grocer. They may need to go somewhere else to a doctor, perhaps. So we're not going to prevent any of that. And but I will say that I don't know what the next day will bring. I mean, as you've seen, we've had to evolve as the science has evolved. I would add one more thing just to keep in mind here, because these decisions are not easy. I mean, no one wants to close the schools. No one wants to ask businesses to close down. It's a terrible thing. It's not what I would want to do. But you have to remember that our information flow is relatively small in terms of our scientific understanding. I say the scientists, the medical doctors, the understanding of this is relatively small. And because we didn't get tests earlier in the United States, and I know I keep harping on it, but if you think of it, the more sentinel surveillance we could have done earlier, the more we would have known where the virus was popping up, the more we would have been able to target the solutions that we're bringing today. But because so few tests were done, because there were so few tests available, because of decisions that were made, more than a month ago by the federal government, we're stuck with using the little bit of science that we have, and then statistics and mathematics.
Last question. What about mass transit, trains, airports? What restrictions do we see on those?
There are not restrictions that are significant other than we've asked individuals to keep a distance, 6 feet, 10 minutes with any individual, and so on. You will, if you have not been in Chicago today or yesterday, mass transit is, there are many, many fewer people in mass transit, many, many fewer people on the roads, and I think you're seeing that in central Illinois as well. So I think, I don't have any answers about what may happen with mass transit. But what I am focused on, frankly, every day is listening to the experts and making sure that we're doing everything, I mean, I really mean everything, to encourage people, particularly those who are most at risk here, to please stay home. If you are in the at-risk categories of being elderly, if you are older, if you're over 80, if you're over 70, if you're over 60, it's something that you really should seriously listen to. And if you're someone who's immunocompromised in any way, someone who's getting cancer treatment or has diabetes, you should stay home. You should, you know, if someone else needs to go grocery shopping for you, that would be a great thing to have done. And maybe a neighbor can go do that for you and leave it on your front stoop. But it's very important. We have to do everything we can to protect the people who are most vulnerable. Last thing, for the people who think that they're the least vulnerable and most invulnerable, the young people who feel just fine and they think they're just fine because they haven't heard much about coronavirus affecting people their age group, they are carriers potentially. And so for those out there who think that you're immune, you're not. For counties out there that have said, well, gee, nobody in my county's gotten it. I live in an area where people just don't get these things. This seems like something that only happens in Chicago. You're wrong. All over the world, in rural areas, people are getting coronavirus. It is coming, unfortunately, to everywhere in the state of Illinois. No matter where you live, it will come. And so you need to be prepared. You need to listen to what we're saying. And we will, as a result of the positive actions that we're taking and that individuals across the state are taking, we will bend this curve and we will save lives. Thank you very much.
Thank you.